Hi, it's Rich Miranda of Zahn Dental. For our lab customers, your teams, your families, we hope everybody is healthy and safe and okay during this COVID-19 pandemic as we all work to get through it together. I am really happy to be joined by Gary Morgan. Good morning, Gary.
Morning.
See you in there in your house in Atlanta, Georgia. Gary is the Vice President and Compliance Advisor of SafeLink Consulting. SafeLink is a provider of OSHA and FDA compliance and really the leader in our laboratory industry. And we know how really busy you are right now. So again, appreciate you taking the time to be with us here today.
A pleasure to be with you.
So the good news is states are opening, businesses are opening, our dentist customers are opening. And now the work is how do we do it? How do we open safely, right? That's what we have to work on together.
Yeah,
And
absolutely.
And yesterday, SafeLink and NADL did a tremendous webinar, really, Gary, that you led. And it had really detailed, critical information for our lab customers of what do they have to think about as they go back to business and they need to do it safely. So we really want to make sure, and our team's going to push out that webinar to all of our vehicles to make sure that our lab customers really see that in detail. But we thought we'd spend maybe a few minutes with you hitting some high-level topics that are covered in the webinar, and hopefully our lab customers then will spend some time going through it. And Gary, when you think about your career, because you've been consulting for quite a while to the lab world, and you've been a lab owner and a lab leader, how many labs do you think you've trained over your career?
Well, I would say it's getting up there probably close to 1,000 labs.
Yeah, wow, it's terrific. And this is the time where you kind of get to say, this is not a drill, right? This is what we've been training for, right? This is what we put all those procedures in place and all that. Like this is the time when it really is needed and it matters.
Yeah, we really didn't wish for it to happen this way, but we've been trying to promote that labs, should have been planning for something like this all along. And if they had put in the right protocols, then it really wouldn't have changed how they operated. But
Yeah.
I think this one kind of brought it home because now it is in everybody's life. It's in everybody's activities. So I think it's very critical now that we talk about these issues and that labs understand that you know things have changed and they have to be able to work in those changes.
Yesterday at the beginning of the webinar, the first topic, I think one of the first topics was team safety. How does the lab leader prepare for team safety screening? What do they do if a team member shows symptoms? Can you talk a little bit about what they have to think about around team and workplace safety?
Sure. A lot of the labs furloughed employees or even laid off a lot of employees when the pandemic actually uh, spread so widely. And because of that, trying to return to some kind of normalcy is a little bit challenging. They've got to remember that now all of those workers have been out in the world, and now they're going to return back into the workplace. So it is really, really critical to try and control the workplace environment so that we don't have infected employees or potentially infected employees coming into the lab environment and then potentially passing it along to other individuals in the workplace. So there's a lot of guidance out there for this from some of the government agencies talking about how you integrate those employees back into the workplace, even giving you some allowable actions that you wouldn't have thought about doing before, like implementing temperature checks. Somebody
Hmm.
walks in the door, whether it's a new worker, an existing worker, even a patient, you want to try and take that temperature because that's going to be the first indicator that there might be an issue. But you've also got questions you need to ask. Has an employee been in contact or been around someone who was suspected or positive for COVID-19? So that's really critical. Have they traveled to an area where it's widespread or have been an issue? So you can ask those kinds of questions now that you wouldn't have asked before. You still have to protect the employee's privacy with these questions, but we're recommending that labs do this every single day.
Hmm.
So before people walk into the business, they go through this screening process because once they're in, and if it turns out that they are infected, Now you've got your own mini epidemic in the lab potentially, and now it's going to affect you even harder because you've got sick people that have to be quarantined. So there's definitely protocols you can go through, and I think just everybody needs to understand what you can do and what you shouldn't do. But you are allowed to ask more questions than you ever were before about an employee's health.
And yesterday you also mentioned that, hey, critical that you tell the team up front, here's the rules, here's what's going to happen every single day. And, I think team members will appreciate it and feel good about it, right? Because they have to be concerned about their own safety. It's the right thing for them to do.
Yeah, I would hope so. I would hope they would be concerned about their own health and know that the employer is doing this in order to protect them and everyone else in the workplace.
Now, as they go back into the lab, they still also need to try to maintain space and social distance. And you mentioned yesterday, and every lab is going to be a little bit different here in how they do it, but you had maybe some thoughts about how a lab might be able to create some of that space. Maybe you could talk to a little bit of that.
Yeah, it's kind of difficult based upon size because a lot of the labs in this country are small,
Yeah,
and it's going to be a little bit more difficult to create that distance in a small lab than it is in a large lab. But it can even be difficult in large labs to, uh, in that work environment, still have people doing their jobs while not getting too close to one another. So, some of the things that you could look at would be alternating positions at a workbench. Most workbenches are designed where people sit next to one another. Maybe you have an empty workspace between the two individuals. If they're sitting across from one another, alternate that so that they're not sitting directly across from one another. In those rooms where you have a lot of activity going on and multiple people going in and out, you just need to train employees that they need to try and respect social distance. You're going to have people passing one another all the time. What we really need to think about is extended period of time in contact, because just that passing by one another is not going to be the big concern. It's going to be when you're working closely with somebody. You may be looking at, say, alternate shifts or alternate hours for certain tasks so that you don't have people
right,
in specific areas. So there are quite a few ways you can maintain that physical distance. We call it physical distance in the lab, not social distancing, but
right.
physical distancing to get that space. But I think there are ways you need to look at it and think about the employees, understand what their concerns are in doing that as well. And then, of course, PPE is going to help as well.
Perfect. And so let's stay on PPE for a second, the protective equipment. You know, I even forgot until I started watching your webinar, and I had seen it also on the ADA webinar, that there's a real specific way you put on your gloves and your gowns and your masks, and there's a real specific way you take it off. And it's not hard, but if you don't do it right, it won't be effective. I think you pointed to a place where they can find those instructions. Where can they find those instructions?
Sure. The Centers for Disease Control, the CDC, has a great resource for that. All you have to do is Google CDC PPE poster, and you can find that poster. There's a lot of variants on it. It will cover a lot of different combinations of PPE so that you will see, well, what order do I need to put them on? What order do I need to take them off? How do I properly take them off so I don't cross-contaminate
Right.
one to the other? Which ones can I repurpose? Which ones can I not repurpose? And things like that. So those charts are available. And we encourage every facility to download those and post those in the facility and train everybody. Do a documented training on how to properly wear them, put them on, take them off, dispose of them, manage them, if they can be disinfected. All of those things need to be considered, especially now because of the shortage of a lot of this PPE.
Right. And now we know that the guidance from CDC for dentists who may be treating a patient that has symptoms or has COVID, they're going to be wearing the N95 mask for that type of case. Maybe even beyond that because they may not know who they have or don't have. So we know dentists are going to have the N95 mask likely. Is that needed in the lab space, the N95 mask?
Really, it isn't, and we discourage labs from using up those N95 respirators in the lab for those kinds of purposes. Because when it comes to the transmission of COVID-19 from the dental practice, there's very minimal risk because you're not exposed to the person. Now, you do have issues with disinfection that you want to go through, but even with that, you're not dealing with the major way this is transmitted by droplets. So if I cough, sneeze, even talk, then I can transmit it, and you're not dealing with that in the lab. What you would be dealing with is hard surfaces, items that may be contaminated. And so in that respect, we really discourage labs from using the N95s in the lab for those particular purposes. Now, obviously, it's up to an employee and a laboratory owner to determine when they want to. But if they get to the point where they're requiring them, it just raises a whole lot of other issues with OSHA, and you have to go through a lot of other protocols, including fit testing and medical questionnaires, all sorts of things to say you've got to wear one of these. So we do discourage wearing those. You should still keep N95s on hand for exposures to hazardous materials, because there's some instances where you would definitely want to wear an N95 for that. And that's primarily what those respirators should be used for in the lab environment.
Perfect. So the incoming receiving department of the lab, where they've got the cases coming in from the doctors and probably still have many manual impressions coming in, that case receiving department has always been an area of potential transmission, and we had to be the right rules and the right infection prevention. What specifically around COVID-19 do they need to think about as those cases are coming in today?
Well, honestly, and I kind of made this statement very early on, that if you were doing the proper protocols under standard precautions, you really didn't need to be that concerned, because COVID-19 or SARS-CoV-2, which is the virus that causes COVID-19, is really easy to eliminate. It is not difficult to inactivate. And I use that term instead of kill because it's not a living thing, but so you can inactivate it very easily. You can rinse it away. You can wash something. That's why they say use soap and water on your hands, because that's really effective in getting rid of the virus. So the same thing in the lab. Proper protocols, you're wearing PPE and you're disinfecting, going through your proper steps of rinsing something away, disinfecting it. You really shouldn't have that big a concern when it comes to COVID-19. It's more important in the dental practice there to handle it. My concern is in the packaging itself. How you handle the packaging, because that is one area you can't control. And so you do need to make sure that you understand that, because that's something probably a lot of labs didn't think about before, because that was not a method of transmission for most bloodborne pathogens, but it could be for COVID-19.
And you mentioned, so it's a great point, you mentioned yesterday that this might be a good time to have a conversation with their dentist customers about how they want to receive the cases. What would they cover in that conversation with the dentist?
Well, I think it's a great time to have a conversation, both for how you're going to package it from the dental practice, send it to the lab, and then the other way back to the practice. And I think labs and dental practices ought to open a communication channel that says, what are the expectations for each business from the other? And it would be probably a good idea to even develop a written protocol so that you could communicate that, say, this is what I expect the doctor's office to do when they're packaging things up, how I want it properly packaged so that it minimizes any risk in the transfer from their office to my lab. Because, we may have our own employees who are picking that up. It may be UPS or FedEx doing it, but you still want to protect those individuals. So proper packaging is critical. Where you place it, where do they pick it up so that they don't go into the dental practice deeply and have a more potential exposure there. So that's a really critical part of it. How you send paper documents, because if the documents included with the item that's been contaminated, well, now it's contaminated. And there's no real clear way of how to disinfect paper. So then you have to think about, well, what did the lab do? I mean, I want to instill confidence in my dental client that I'm protecting them. And there's no real requirement anywhere that says dental labs have to disinfect items sent back to the dentist, except in a few states. So from that standpoint, I think it would be a good opportunity for the lab to say, look, we're going above and beyond. We're going to protect you, and here's how we're going to do it. But you need to then decide how you're going to disinfect those returned products. And there are definitely easier ways to do that sending it back to the dentist than the other way. But communicate that. You can even label it. Have the dentist, maybe it's a sticker on the container that says, this lab did it. It's good marketing too, because open it in front of the patient. The doctor has it right there and it says it's been disinfected. And that shows the concern that the lab has for the patient safety as well.
You just said something which I totally agree with, and maybe we'll just summarize it one more time, because you also do a lot of the same consulting for dental practices.
Absolutely.
And there's, you said it, dentists might want to hear a very strong message from our labs about what are they doing as it relates to safety, and as they open up, that I can feel comfortable as a dentist to be working together and accepting cases. So maybe one more time, say again from the dental side, what would a dentist want to hear from that lab?
Well, I do want to know what their disinfecting protocols are. For one reason, I want to know and make sure that my product is not going to be affected. If I'm going to make a crown, if I disinfected the impression and then I send it to you and you disinfect the impression, is in some way that going to change the dimensional accuracy, and is it going to affect the end product? So that communication helps resolve some of those issues, but it also, I think, gives the dentist the understanding that the lab does indeed have these protocols in place. A lot of dental practices don't understand what the lab does. They've never visited the lab, they've never communicated with that lab, which I think is really important. We used to encourage our dental clients to come to the lab. We wanted to see what we were doing so they understood we were doing the same things they were. We were dressing in all this PPE. We had a controlled area for doing this. I think that would be very good for that communication to occur, and it gets a good communication channel open between the two businesses.
Maybe at this time where maybe visits aren't going to happen immediately, maybe a bit of a quick video from the lab.
Virtual,
Showing
yes.
the team in their PPE and describing their infection control procedures and saying they're ready to be safe and open for business. And
Absolutely.
I think that'd be very, very good. Well, Gary, we really appreciate your time today, but even more importantly, all that you and SafeLink are doing for our lab customers to help them, as you've always done, be safe and have all the right infection protection controls and compliance and training, but even more now as we come back to business here. So we really, really appreciate all you're doing. We'll make sure our lab customers know exactly how to connect to you if they have more questions. And we're really, again, with this couple-minute discussion, urging our lab customers to view that webinar that we're going to push out again also from that you, SafeLink, did in the NADL. So thanks so much, Gary. Really appreciate it.
Thank you very much. I enjoyed the conversation today. And again, I think this is a team approach. So every time we can get a message out, that's great. So I appreciate this very much. Thanks for having me.
Thank you. And to our lab customers, again, as we always say on each of these videos, our entire Zahn team is here. Anything you need related to this subject or any answers or questions you have in opening, going back to business, getting ready to go back to business, the whole team is here. Our sales team is here. You can contact telesales, our key account managers. We're here to help you get back to business. Please stay safe, healthy, and we look forward to seeing everybody real soon. Thanks very much.